Hey guys, and welcome back to the Chronically Ill Diaries podcast. I'm your host, Jane, and I'm super excited about today's episode because we have my good friend, Ashley Smith, joining us. You might remember Ashley from a previous episode called Unbreakable Bonds Navigating Childhood with a Sick Friend. If you haven't already listened to that one, make sure to check it out after this episode. Ashley is currently going to school to become a dental hygienist, and on today's episode, we're diving into a super important topic, the connection between chronic illness and oral health. She is incredibly knowledgeable about this, and she's sharing some valuable insights that you don't want to miss. And I can't wait for you guys to hear everything we discuss. It's such an important conversation. So, on that note, let's get started. How are you? What should I call you? Doctor, nurse? What's your official name once you graduate?
Registered dental hygienist, but right now I'm just a dental hygiene student.
Okay. So you will soon to be in a few months a registered dental hygienist. So I'm super excited because I remember when you originally told me just about lupus and dental issues in general. It was very fascinating to me because obviously that's scary, but people don't talk about that. In fact, what dentists usually say when you go to the dentist with a chronic illness, they say, hey, take this pill and that's it. Like they don't tell you anything else that's going to happen. And a lot of times, not the nurses, the dental hygienists don't even mention the pill. So I feel like not everyone's on the same page when it comes to this kind of stuff. So this will be really good to have this conversation about chronic illness and your dental health. So, with that being said, I just want you to go ahead, kind of reintroduce yourself. You've been on a different podcast for a totally different topic, and just kind of introduce yourself, and then we'll get started.
Okay, hi, I'm Ashley. I'm a dental hygiene student in the Central Valley, and I am almost done with school. So once I pass national boards, I will be a registered dental hygienist
And that's gonna be very soon.
very soon.
And we're gonna party hard once that happens.
Vegas.
Right. What? Okay, that'll be for later. Anyway, all right. So, a lot of you listeners out there obviously probably have a chronic illness or you know someone with one. And like I already mentioned, one thing that we don't educate ourselves on or get educated on from our doctors is oral health, which could be a major issue when it comes to having a chronic illness. Myself, I have gone through certain issues with my mouth that could include like sores in your mouth or just like getting cavities really easily, just little things that can happen that could lead to much bigger problems down the line. So, Ashley, how would you say chronic illnesses affect your oral health?
So, having a chronic illness affects you systemically. So, your mouth is part of your body and it gets affected. And there's diseases that are temporary, that are reversible. And then there's others that once the bone is gone, it's gone and it doesn't come back. And when you're first diagnosed with a chronic illness or an autoimmune disease, doctors focus on the biggest problems. They're not focusing on oral health. And they themselves are not that educated on oral health themselves. So they don't think to tell you. And then a lot of dentists don't think to tell you either. And it gets stuck in production and they're worried about time and getting you out of the chair. So it's really up to you.
Would you say, sorry, I don't mean to cut you off. Would you say a lot of dental hygienists don't necessarily know a lot about chronic illness and the correlation to oral health in
So
general?
this is the very frustrating part because we go through anatomy and physiology and chemistry and all these prerequisites. And then we get further into detail about these things. An autoimmune disease is type 3 hypersensitivity. And to give you more perspective, hypersensitivity type 1 is not having an allergy to nuts and going to anaphylaxis or asthma. So, as you know, your body attacking itself. And there's oral manifestations that show up within chronic illnesses and autoimmune diseases. And a lot of people don't realize that your hygienist and your dentist and your dental assistants are usually the first line of seeing an illness. Cancer, we do cancer screenings all through your lymph nodes and intraorally. And
Wait, is that on a normal exam or do you have to ask for that?
it should be standard of care. Blood pressure and ENI, extra and intraoral inspections should be standard of care. And if it's not, ask questions.
So what does that entail? Is that like the normal x-ray or is it something else that you go through?
The clinician takes their fingers and feels your lymph nodes, and if they're enlarged, and if you have periodontitis, it should be every 3 to 4 months. But a lot of times, insurance doesn't cover that unless you are like aggressive perio patient, which I will go into that information later. But like with lupus, a lot of people say their first sign was like the butterfly rash. Well, actually, most of the time, it's urticaria in your mouth. It's sores, redness, swelling, open sores that go away. Those can be your first line of symptoms before you ever get a butterfly rash. Or cancer, one of the first places that you see cancer is on the side of the tongue and or the floor of the mouth, and people don't realize that. So that's why patients need to be educated on these things.
Is that specific cancers or is that just a sign of cancer?
Or oral cancers, or a lot of times if you have like a blood cancer,
Hmm.
because if your blood is not being like adequate, like your body's like, forget the mouth. We have other issues, pretty much.
I do know, luckily I don't get them, but I've noticed that when my lupus does act up, I get sores, like on the gums, along the bottom of my gums. And sometimes, it's mostly there, like the lower teeth and across the front, I will get like these little like bumps. And luckily I've never had one open or anything like that, but they hurt. And sometimes they're there for a very long time. And I'm one of those people, which I feel like a lot of people are, uh, that if you have something weird in your mouth, you're gonna mess with it. And so I would always like bite it and stuff. And so it would just linger for a really long time, but I didn't know what it was. I thought it was like a salt thing, like, oh, I've been eating a lot of salt. I have a bump on my gum instead of my tongue. Like, I don't know. But all along, it was that, which I never knew. So that is very good to know.
Mm-hmm. And it is missed a lot because your epithelial cells in your tissue in your mouth takes a week to heal. So if you go to the dentist every 6 months, they're not going to see these all the time. So that's when you need to say, I'm getting these sores on a consistent, regular basis, and this is what it's like. Can you give me an idea of what's going on?
Hmm.
This is like when you really have to advocate for yourself because you're maybe in their chair for an hour. So you really have to ask questions and be aware.
Yeah. So, how knowledgeable are you on like medications that doctors give people before they see the dentist? Do you have any background on
Okay,
that?
so for California, every state and their requirements and their classes are different. Um, every hygienist in California is very aware of what autoimmune diseases are, how it affects your body, down to the chemical and cellular level. We can break it apart. And we know the signs. We were taught, it's drilled into us. The problem is we forget, we think about what we see on a daily, monthly basis. We don't think about something we see a couple times in our career. The instructor that was actually giving us lectures on autoimmune diseases said he saw lupus one time in his career. And I think he's been practicing more than 25 years. I
Mm-hmm.
just so happen to see a lot of autoimmune diseases because it's a free clinic and people that can't afford care come. So I see more. But maybe 20 years from now, if I haven't seen a certain thing, I'm going to be hazy on it and I might not pick it up.
Mm-hmm. Yeah, so it's really good. Even like, obviously, you're in school, but 10 years from now, you're going to be like well into your career, you're going to be established, and it's so important to keep up on all these new diseases or even refreshers on old things that you might have forgotten because, like you said, like you might not see something in however many years, but then it comes up and you want to be able to like care for that person just as well as any other ordinary fucking person that comes in.
Mhm.
Yeah.
But we do know, I'm actually in pharmacology right now. I have to know like how it affects our body, which signals are sent, which signals are blocked, and how each one affects one another. So we know a good amount of meds. And in your chart, we are supposed to be taking all your meds, how much, how many times you're taking it. We have to be able to know the category and the contraindications to other medicines. We just have to know a lot about pharmaceuticals. So, and also leading into that, autoimmune diseases cause oral manifestations, but um, uh, so do what's the word? Medications.
Right. Yeah. Can you go into a little bit of that? Because, like we were kind of chatting about earlier, you might not be having issues with your mouth in any way, but then you take medications for your issues and it starts causing issues from there.
So the two main ones, the two biggest ones I have already seen that almost everyone who is on medications, it's one of the biggest, is xerostomia and candidiasis. Xerostomia is dry mouth, and candidiasis is a yeast infection. So if you know you go on antibiotics and then you know you're going to get a yeast infection, you are well aware of what happens. And immunosuppressed people have high risk of candidiasis. And there are signs, and not everybody knows them. It's not always painful, and it could come up anywhere, your scalp, your feet, your mouth, your genitalia. You could all have yeast infections everywhere. And there's signs like angular colitis is sores in the corner of your mouth that could come from just your autoimmune disease acting up, anemias, um, candidiasis, even just from xerostomia itself. And people don't realize that they have xerostomia unless they're told or notice the difference themselves. Like your tongue is sticking to the roof of your mouth, you notice your lips kind of get stuck when you talk, you have xerostomia. And that affects your like it affects your cavities. You could get more diseases, you could get bone loss, and you already are immunosuppressed and you already have an autoimmune disease. Periodontitis is bone eating away at itself, trying to protect your body from the pathogens and the bacteria in your mouth. So it will just eject teeth to protect yourself. It's attacking yourself to protect its mouth.
That was very like a lot. I'm taking it in. That's why my face looks like that because I'm literally processing what you're saying and visualizing it all at the same time. So again, if you had a patient in the chair and you like started working on them and you noticed that, like how would you kind of go about bringing that up to somebody?
I would say, hey, I'm noticing that your mouth is a little on the dry side. Have you noticed any changes or any difficulties? And usually they say, oh, no, I haven't noticed anything, except sometimes my cheek sticks to my tongue or something like that. And then later on, I go into ways to combat that, how to lower risks for disease and decay, cavities.
Okay, that's good. I like it. I like it. Okay, now that we've gone over like the scientific side of what could possibly happen, what's going on, let's go into overall oral health and care. Take it away.
Okay. So, the most basic, fundamental things before anything else is brushing and flossing. The only way you can remove the bacteria that causes disease and cavities is by mechanically moving it. You could use mouth rinses, rinse your mouth out all you want, but it's not going to get rid of that sticky white substance on your teeth. You have to take the ends of the toothbrush, the ends of the bristles, and actually move the bacteria yourself. And since the brush doesn't get in between your teeth, flossing is what gets the bacteria out from in between the teeth. And where you start losing bone and where you start getting inflammation and puffiness and bleeding is in between your teeth.
Mm-hmm.
So doing that twice a day, amazing. I would be so happy. You will notice a difference, your clinician will notice the difference, and we will all be a happy group.
What about tongue scraping?
Tongue scraping lowers bacteria. Every patient I see, I hand them a tongue scraper. Here, while you're brushing your teeth, while you're in there, scrape your tongue. It diminishes your bacterial growth and halitosis, which is bad breath, very drastically. You will notice the difference. And I keep saying xerostomia and halitosis, like the actual words, because those are the words you will see on your pill bottles. These are the things you will see on your discharge papers. So I want you to remember halitosis and xerostomia.
Mm-hmm. I know I was thinking about this morning. Um, like yes, brushing your teeth obviously is like a great thing, right? But like sometimes like if I brush my teeth and I don't like clean my tongue, I notice like you still have that like nasty taste a little bit in your mouth.
Mm-hmm.
And then I would be like, dude, my breath and like this taste and like this feeling, like I feel like my mouth is dirty, even though I just literally brushed my teeth for so long. And yeah, I don't know. I was just thinking about that today. And it's like you get a good tongue cleaning, and suddenly you feel like your whole mouth is just so much cleaner. Like it's just such a good feeling inside. And a lot of people don't clean their fucking tongue.
Well, we have little hairs on our tongue.
What?
Yeah.
Okay, go on.
And all it does is collects bacteria. And then when you see white, that's bacteria. Brush your tongue,
Mm.
scrape it. I don't know, get your finger, scrape it. You will see bacteria on your tongue, on your finger that you scraped off your tongue.
Yeah.
So no shame, no judgment. But now you know. So brush your tongue.
Yes, I saw, sorry, this, I'm not trying to get off topic, but I saw a TikTok one time and it was like, it was like, I'm not kissing you until you like clean your tongue or whatever. And then that like made me start thinking about it. Like, don't skip a day because I'm not gonna lie. Like, there'd be times I'm just like, oh my God, whatever. Like, it's not that big of a deal. And then I would notice like it doesn't feel as clean. But then I'm like, okay, your breath like comes from that tongue. That's disgusting, you know? Yeah.
You also described a taste in your mouth. Did it like taste metallic-y?
No.
Oh, okay. Because a
What?
lot of side effects for medications are like a metallic, tingy taste in your mouth.
So that does happen to me sometimes, and I think it is from medication because there's been times where I would taste that and then I think something's bleeding in my mouth. So I would like start spitting and it wouldn't be blood. So then I would be so confused. I'm like, did I just swallow it or something? But that's happened a couple times where I've noticed like randomly my mouth would taste like blood, kind of like metally,
Mm-hmm.
whatever. And I was like, ew. And then there'd be no blood. But no, what I was mentioning was just like that, like not clean, like
Mm-hmm.
taste, morning breath still.
Especially after coffee.
I'm like, yeah, like right now, I have this nasty like film.
Mm-hmm. Yeah.
Okay, so first and foremost, the basics that we learn as a like 2-year-old is brush your teeth, floss your teeth, clean that tongue because that's the nasty
Hmm.
eye. Um, what other tips do you have?
So that's for basic person. And then as an adult, as you get older, I highly, highly recommend an electric toothbrush if you can afford it. Don't get like the cheap $40 ones. Strive for Philips or Oral-B because it will change your life, especially if you're dealing with comorbidity issues like arthritis. Just holding it here and counting to 10, and then moving, counting to 10, it will change your health and your ability.
Question. How does arthritis affect your mouth? Vice versa. How does that happen?
Okay, so arthritis, we only have really one joint that we focus on, which is our TMJ, and you have two of them. And you could get popping and clicking. So if you have arthritis, you're kind of already like aware of your joints and you think about them. So like if you are having popping, clicking, any pain, let your clinician know, and then they can assess and see how bad it is and make a referral so you're seen by a specialist.
So it has to do with opening the jaw.
That, yeah.
Okay. Okay. Also, I wanted to mention if you could send me a link to the toothbrushes that you were talking about.
Oh, I am going to go over so many products. I will send you links.
Yes, send me all of the links for everything and I will put
Hmm.
it in the description
Okay.
just so everyone knows it'll be in the description. But okay. So electric toothbrush, I'll stop interrupting you and you can keep going. Sorry, I just have
Okay.
like random questions as we go, but
No problem. The next one is a water pick. This is on the pricey side as well,
ooh,
but if you take care of it, it will last a long time.
I'm not gonna lie, I hate those.
I I learned to love them because I feel so clean.
They hurt. Is that enough?
It's too high, girly. It's too high. Turn it down. Okay. And then putting hydrogen peroxide into the water will help diminish bacteria significantly.
Wait, what
Just
water?
the water for the water pick.
Oh, sorry.
Like fill it up and just put a little capful of that brown bottle, the hydrogen peroxide in it, and will help kill bacteria. And then
Okay.
my favorite floss is more on the expensive side. You could use whatever floss, it doesn't matter. But I prefer the cocoa floss because it has webbing and it just takes up more surface area. So like you don't have to work as hard to remove things.
Mm.
And then going into mouth rinses, mouth washes, there's so many different kinds. It's overwhelming going down the aisle. They all do different things. So if you have dry mouth, get a rinse. If you are high risk for cavities, get a rinse. So many. I like Act. If you are always getting cavities, get Act mouthwash. And then I'm still trying to find a good mouth rinse for dry mouth. I'm not loving them. They're not awful, but the other things I'm going to recommend are actually do more for me. Like I've noticed a difference when I
Do
tried
you
them.
have dry mouth?
No, but I try things. I want to know what I'm recommending.
Right. Okay. I
Mhm.
was just wondering.
Oh, and I don't really recommend Listerine. I don't really like it. I like Act and TheraBreath
Mm-hmm.
are those the big ones I like. And then the Crest, it's a blue bottle. It's on the more expensive side, but I have really, with myself, it whitens my teeth and it has hydrogen peroxide in it. So it's the Crest Peroxyl. I really like that. I have a high risk of cavities, so I use it and I've noticed a big difference. And the Act. And also with toothpaste. So as I said, brushing, the mechanical movement of moving the toothbrush is what actually helps you
Mm-hmm.
prevent cavities and move the bacteria. But toothpaste aids in that. So I really like stannous fluoride.
What's it
And
called?
stannous fluoride,
Stannous fluoride. Okay.
and it's spelled like how it sounds. And that really helps with remineralizing your enamel because over time it breaks down and you want to add more minerals into your enamel.
Okay.
And do not rinse it out. It's going to feel nasty. You're not going to like it, but do not rinse out your toothpaste for 30 minutes. Don't drink water, do not eat, don't rinse it out. You want that fluoride sitting on your teeth. Otherwise, you might as well just brush your teeth like without toothpaste because you're just rinsing it out right after. And
Yeah.
maybe don't use a rinse. Do use rinses after a meal because every time you eat, it changes your mouth to a more acidic environment, and that's what weakens your tooth surfaces. So just think every time you have a snack, you grab a snack, oh, wait, that's going to make my mouth more acidic. And it takes 2 whole hours for your mouth to get back to that safe level of pH for your teeth,
No matter what you eat.
no matter what you eat.
That's crazy.
Some make it worse, like coffee, because it's so acidic.
As I'm drinking coffee.
Yeah.
Oh,
But like inevitably, it will be acidic. And it takes time for your saliva to bring it back to a pH. So imagine you have dry mouth,
mm-hmm.
it's that time is extended. So your teeth are susceptible to breakdown from the bacteria and the acid.
Mm-hmm.
So when you see little white spots on your teeth, that is weak areas in your enamel. And those are called incipient caries. So they're not a big deal. They could be reversed. Keep adding fluoride. Fluoride is going to be your best friend. And
Actually, I need
no,
those links. I need those links. I
I
have
will be sending those things.
I have that. Oh
Yeah.
no.
You are not going to overdose from fluoride. It's not bad. Just don't eat it. Keep it away from your children.
I I feel like this might just be me personally, but like when I had braces, for example, I took my oral care a lot more serious because it felt like
I
there was
remember.
a
Yeah.
reason to. Like I brush after every meal, every snack, like always taking care of my mouth. Um, Not gonna lie, I probably haven't had a good floss in like since the last time I went to the dentist because I have
Mhm.
permanent retainers and I don't keep buying the picks because then you
You
have to,
need the threaders. Get the threaders.
well, yeah.
That's why your water pick will also help.
Okay,
Use the freaking water pick.
that might be my solution is getting the water pick so I don't have to thread the floss and put it through the
Hmm.
freaking hole and like all this stuff because I have two and the top one isn't a bar. The top one's different. Anyway, it's so off topic, but I would say now I just don't really I haven't really cared. I just like I brush my teeth, I
Hmm.
brush my tongue, I floss here and there and I'm good to go. But obviously that's I know
I'm
that,
not. I'm
but
not saying use the water pick as a replacement because nothing replaces floss like floss. But using a water pick will help, especially here. It's so easy to get.
yeah.
But like if you don't remove it, you'll get calculus, which you can't remove on your own. I would have to do it.
I was gonna ask you, is there supplements that could aid in any of these top things that we talked about when it comes to overall health for your mouth,
Um,
other than fluoride, or is that like the main one?
hydroxyapatite type, but that's not well known in the US. But there's no like, from what I know from my education, I have not seen any medicinal products that can help. But there are like gums and suckers and lozenges to help you with that.
What do those do?
So xylitol is the sugar alcohol in it, and it's a naturally occurring alcohol that's in blueberries and strawberries, fruits. So there are natural suckers and natural lozenges you can use, but also there's gum. So like if you look around for sugar-free gum, just look at the bottom corner, and if it says xylitol, it starts with an X, Y. That will help you. And xylitol helps with um, inhibiting bacterial growth and also can help with yeast. So those are two things you're combating is candidiasis and xerostomia. So the dry mouth and the bad breath and what else? The yeast infection in your mouth. So always chewing, always sucking on xylitol. It helps with saliva production. It's just anybody. I recommend those to everybody because it doesn't hurt. They're not like, it's not like candy. It looks like candy, but it's not. And I give them to my daughters. They'll take them over Skittles. So I'm very happy with that.
Oh, okay. And you can find those at like a store.
I buy them off of Amazon, but like extra gum, like not all of them have xylitol, but if you just like look in the bottom corner, it tells you if it's xylitol gum or not.
Okay.
And that really helps with saliva production. It helps like salivate.
Mm-hmm. Which makes sense now that I'm thinking about myself chewing gum. Um, what about teeth whiteners? Good, bad? What are your opinions?
Um, I will always recommend professional whitening before everything else. But the amount of hypersensitivity that people tell me that they have, I don't recommend it. I don't like recommending. I whiten my teeth myself, so like, but I've heard so many people say it feels like they have a shooting pain going up their tooth because they're so sensitive. Because what whitening does, we have little tubes in our teeth that go straight into like the middle of our tooth. And it slowly empties those tubes and there's nothing filling it. And usually like minerals fill it. And with the fluoride, you're putting it back in. So use white strips. Don't use them as directed. Don't go overkill on them, but also every time you use whitening, add fluoride.
Okay. Yeah.
Kind of like alcohol. Like you have a shot of alcohol, you drink like twice as much water,
Mm-hmm. Balance
Same.
it out.
Yeah.
Yeah. Okay. Okay. That's good to know. Just because I always felt like people do say a lot of times that whitening strips hurt your teeth, but at the same time, you want to have white teeth and you don't want to
Mm-hmm.
pay to get it professionally done.
Mm-hmm.
But is that like taking away from your enamel? Is that like that's, I don't know, that was kind of my question there, but
That's
okay.
it's a good question because people are always thinking about how they look and they're worried about that. But if you have, I don't want to sound mean, but there's too many people with big disease issues and they're worried about their white teeth. It's like you got to save your teeth before you worry about the white teeth.
Hmm.
And with periodontitis, it's not painful. It happens slowly. You don't know that you have it. A lot of times, I don't know until I start probing and measuring your pockets and see it on the x ray. So you never know because it's not painful and you're worried about your white teeth when really you have a disease. And then if you're immunocompromised and you have a disease, and just think about like open holes when you're bleeding because the bacteria created holes within your pockets inside your teeth, like around your teeth. You're immunocompromised, you have this big disease in your mouth, and then you're constantly exposing it to bacteria because the amount of viruses and bacteria that live in our mouth. Mm-mm.
Right. So basically, just kind of circling back, if you have a chronic illness, you're kind of like anyone else, where obviously you can get anything and any virus or whatever within your mouth, but the chances of it progressing and becoming a lot more worse is a lot higher for you. So like
Mm-hmm.
those two main things that you were speaking about could be happening without you even knowing compared to the average person that, it might take
Mm-hmm.
a lot longer to develop or
Exactly.
whatever because you're on these autoimmune suppressants, which is very scary. But good to know because then people could be kind of more on the lookout.
Mm-hmm.
Um, and reminding themselves to go see the freaking dentist every six
Yeah. Also, so if you have periodontitis, it's like not the end of the world. If you're stage one, it's not a big deal. There's three stages: stage one, two, three, and then there's three grades. That is the rate of progression of the bone loss: A, B, and C. So if you're C, you need some life changes. B is like if you have like diabetes or you smoke and stuff, or the amount of teeth you lose due to periodontitis. A is like you're fine. Just like keep up on maintenance. Just so you know. So like if you hear B, you need to start paying attention, and C, you need to self-reflect on your decisions.
You need to
But
self-reflect, pray
but
about it.
also because we're talking about chronic illnesses, a lot of times it's out of your control. And once the bone loss starts happening, and you're immunosuppressed, it might be harder to stop it. And then once it's arrested and stops, it can easily start again. So like once you have it, you always have to be paying attention because it could always start again. And then you stop it and then it starts again. So
Hmm. This all can happen with your chronic illness being under control, correct? Like it
it
doesn't
happens to
have,
healthy people.
right. It doesn't, you don't have to be in the middle of a flare up or your disease being crazy to have these things happen to you. I just wanted to add that because a lot of times when you are in remission or whatever, like your brain goes off of that. So like a reminder that you could be completely healthy living your normal life, but like because you have these medications and because you have these different diseases, which the list goes on, I'm sure, of how many chronic illnesses are included in that, um, that these things can progress.
Yes.
Okay, what else did you want to touch on as in preventative care that we already haven't covered
Okay.
already?
So, like, this is a chronically ill podcast, and it's not always
Yeah, it is.
gumdrops and smiley faces, you know? So, there's going to be times where you feel like shit and you're not going to want to take care of yourself.
Right.
But I just want you to remember that bone loss does not come back.
And that
So,
goes for your whole body too, not just
mm-hmm,
the mouth, but yes.
yes. So, even if you feel like you can't brush your teeth, stick a sucker in your mouth. Rinse your mouth out with the mouth rinse. Take the toothbrush, you don't need nothing, just move it around and swallow the bacteria for all I care. Like, it doesn't matter. Whatever you do is better than nothing.
Hmm.
And then, like, I not there's always those people in a like profession that are not like good and they like don't like their job, but for the majority of hygienists, we do it and we went into this field because we're passionate about education and um, the underprivileged and people that are don't know, don't have the access. So we want to educate our patients and we want to see them do better. So I don't want you going to a dental office and feel like you're judged or that they don't want you there because they always do. And they're just used to putting in the energy and the patient's not putting the energy back in. So, like, I could only do so much. You have to go home and take care of it. So, we do get frustrated, but we do want to see your mouth healthy and we want to see you doing well. And we do get invested with our patients because we do see them on a like regular basis, especially if you have periodontitis. So we get invested in your case and we want to see you do better. Like this last patient I had, she completely flipped it around and she's doing amazing and I'm so proud of her. But then I have another patient, I spent all this energy on educating and nothing changed. And they both are diabetic, they both are having other health issues, and they are like, you see, I see night and day differences based on their home care. So when you're feeling like shit, it is what it is. Life happens, but do like the best you can.
Yeah, I think that's really good. I mean, at the end of the day, if all you can do is put some mouthwash in, swish it around and spit it out, like at least that's killing a little something in there, you know. But no, those are all amazing tips, amazing advice. I do want to ask you one more question. Why are you so passionate about this field of work? Because there is a million things that you could do with your life, and you love teeth and the mouth. So please tell me and everyone, like, why are you so passionate about oral care?
I wish I had a graceful answer. It's not really graceful. Um, I kind of was always obsessed with teeth and I like picking at things. And that's what I do all day long. I pick at things. It's really
Oh
fun
my,
and satisfying. But like, remember when I told you that I had invisible braces in kindergarten?
yes.
That's how far it goes. I've been liking teeth since kindergarten. Hey, but when I think about it, I was ahead of the curve because then Invisalign comes out.
No, true. You should have invented it. Should have
Yeah, in
pitched that.
kindergarten. Yeah, should have done something.
But okay, yeah, you've just always had a liking for picking teeth, which honestly, I get it because it's kind of fun when you think about it. Um, so I just want to say thank you for being on the podcast. I've been waiting a long time to do this because I just
Yes.
feel like it would be I was waiting for you to get through school. We both were, so that way you can just share all the stuff that you've learned, which is so amazing. But before we end this, I do want you to plug yourself and just kind of mention what you're doing, where you're doing it, and so that way people can find you and get their teeth looked at and properly checked. So go ahead.
Okay. I am at SJVC, San Joaquin Valley College in Visalia. And in order for me to graduate, I have to see a certain amount of patients with a certain amount of criteria, and I have skills to check off. So the only way I graduate is if I have patients. And then on top of it, you get free dental care and diagnosis because there's a dentist there. And actual registered hygienist looking over me. So you like get the most thorough cleaning you ever had because I have to be checked by multiple people. So you should come and be my patient.
Amazing. And they don't get one appointment, right? They can like do they get a full protocol? Like they come.
Because I have to have instructors check, each appointment is unfortunately 3.5 hours. But it is free. And even after I graduate, there's always students. And even if you have insurance, it usually only covers an annual cleaning or a 6 month cleaning. Or when you do have a severe disease, the insurance doesn't always cover it. So this is a good, nice supplemental thing to come to because it is free and you get thorough care.
So yeah, come see Ashley, free cleaning, get checked by a dentist. You're gonna get proper x-rays and making sure everything good is going on. Everything we talked about in this podcast will get done to you. And yeah, so I'll leave info in the description as well. There's going to be a lot of links down there where you can reach out to Ashley directly via Instagram. I'll leave your Instagram, they can DM you. And there's also going to be a text box on the podcast app where you can message me your info and I will send it to Ashley. Other than that, do you have any last thoughts, questions, concerns for me in general?
Don't be afraid to ask questions for any medical questions when you go anywhere. Ask all the questions. And if they're annoyed, annoy them. Period.
Yes, advocate for yourself in every medical setting or any setting in general, but
Mhm.
specifically medical. Okay, well, Ashley, as always, it's a pleasure. Thanks for being on the podcast. Appreciate you. Love you, guys. My best friend since I was a baby. See you next time. Bye.
Thanks for having me. Bye.